Have you ever woken up at 3 a.m. in a quiet room and wondered why you couldn't fall back asleep? It seems like your body and mind are not cooperating, even though you slept soundly just a few hours ago. Many older adults share the same experience, waking up in the middle of the night and not being able to get back to a deep sleep. This can make you worry, wondering if there's something wrong with your body. However, the truth is that this phenomenon is more common than you think, and it's not just a habit of aging. In this article, we'll explore the deeper reasons why many older adults regularly wake up around 3 a.m., and more importantly, what it really says about your physical, mental, and biological health. These are not just surface-level explanations. Each of these causes is linked to the natural changes that your body goes through as you age, from hormones, sleep, health, to psychological factors, emotions, and even small changes in your daily routine. We don't just want to provide knowledge, we want to provide understanding and empathy. Because waking up at night doesn't mean you're getting weaker or doing something wrong with your self-care. On the contrary, it could be your body's way of signaling, a gentle reminder that you're entering a new phase of your life, and changes in your sleep are a natural manifestation of that transition. You'll find that each cause has a hidden message. Sometimes it's physiological, like a decrease in melatonin, a change in your sleep cycle. Sometimes it's unresolved emotions, quiet loneliness, or simply a change in your routine over the years. When you understand these things, you will not only sleep better, but you will also learn to care for yourself with more gentleness and patience. So if you have ever been awake at 3 a.m. and asked yourself, why now? You are in the right place. Let's dive into each cause, not to find fault, but to understand your own body and mind better. Number 1. Reduced production of melatonin with age. As we grow older, it's not uncommon to find ourselves waking up at odd hours of the night, often around 3 a.m., wondering why sleep doesn't come as easily as it used to. While many factors can contribute to this pattern, one of the most fundamental and frequently overlooked causes is the natural decline in melatonin production that occurs with age. Melatonin, often referred to as the sleep hormone, plays a vital role in regulating our circadian rhythm, the internal clock that tells our body when to sleep and when to wake. When melatonin levels drop, this rhythm becomes disrupted, and our sleep can become lighter, more fragmented, and prone to early awakenings. In our younger years, melatonin is produced in healthy amounts by the pineal gland in response to darkness, helping us fall asleep and stay asleep through the night. However, as we age, this production gradually diminishes. Studies have shown that older adults often produce significantly less melatonin than they did in their 20s or 30s. This isn't due to any specific illness or disorder, it's a natural part of the aging process. Unfortunately, this decline can make falling asleep more difficult and maintaining deep, restorative sleep a nightly challenge. Waking up at 3 a.m. may simply be the result of the brain running low on melatonin and shifting prematurely into wakefulness. Compounding the issue, many older adults also experience changes in lifestyle and environment that further impact melatonin levels. For instance, reduced exposure to natural daylight, especially in those who spend more time indoors, can interfere with the body's ability to regulate melatonin effectively. Artificial lighting in the evening, especially from screens, can also suppress melatonin production, making it even harder for the brain to prepare for sleep at night. In this way, modern life may be working against the natural needs of an aging body. This decline in melatonin doesn't just affect the quantity of sleep, it can also impact its quality. Deep sleep, or slow-wave sleep, becomes more elusive as we age, and the reduced melatonin means we spend more time in lighter stages of sleep that are easier to interrupt. A small sound, a passing worry, or even a full bladder can be enough to pull us out of rest at the same time each night. And once we're awake, the body may struggle to produce enough melatonin to ease us back into slumber. The good news is that understanding this natural process gives us power. While we can't stop time, we can support our sleep by gently encouraging our body's melatonin cycle. Simple changes, like going outside during daylight hours, dimming the lights in the evening, avoiding screens before bed, or maintaining a consistent sleep schedule, can all help the brain know when it's time to wind down. For some, low-dose melatonin supplements, under a doctor's guidance, may also provide a helpful boost. Recognizing that a 3 a.m. wake-up isn't necessarily a sign of something wrong, but rather a signal from an aging but still resilient body, can ease the stress and frustration that often accompany sleepless nights. With a few mindful adjustments and a little patience, it's entirely possible to reclaim deeper rest and wake feeling more refreshed, even in later years. Number 2. Changes in sleep cycle. One of the most common, and often misunderstood, changes that occur with aging is a shift in the body's internal sleep schedule. This change, known as advanced sleep phase syndrome (ASPS), causes many older adults to feel sleepy earlier in the evening and to wake up earlier in the morning, often between 3 and 5 a.m. For some, this adjustment can be subtle. For others, it leads to a frustrating pattern of waking too early and being unable to fall back asleep, resulting in fatigue throughout the day. Understanding this natural shift in the sleep-wake cycle can help older adults make sense of their changing sleep habits and take steps to improve their rest. The body's internal clock, or circadian rhythm, governs a wide range of biological functions, including the timing of sleep and wakefulness. This clock is controlled by a part of the brain called the suprachiasmatic nucleus, SCN, which responds to cues from the environment, especially light and darkness. As people age, the circadian rhythm often shifts forward, causing earlier sleep and wake times. In other words, the body begins to wind down earlier in the evening and becomes more alert earlier in the morning, even if the person still desires or needs a full night's rest. This phenomenon is not necessarily a sign of poor health or insomnia. In fact, many older adults can still sleep a full 7 to 8 hours, just on a different schedule than they were used to in their younger years. The problem arises when this shift conflicts with social expectations or personal routines. For example, someone may go to bed at 8:30 p.m., wake up at 3:30 a.m., and lie awake for hours, wishing they could sleep longer. This misalignment between biological sleep timing and social sleep timing often leads to sleep dissatisfaction, even if total sleep duration hasn't changed much. Environmental factors can further influence the effects of an advanced sleep phase. Reduced exposure to natural sunlight, especially in the evening, can reinforce the body's tendency to fall asleep early. Likewise, bright light in the early morning, whether from sunrise or indoor lighting, can cue the brain to start the day too early. Over time, this can become a pattern that's hard to break, especially if it's accompanied by other age-related changes in sleep, such as lighter sleep or more frequent awakenings. Fortunately, there are ways to gently nudge the sleep-wake cycle back to a more desirable rhythm. One of the most effective strategies is light therapy, which involves spending more time in bright light during the late afternoon or early evening hours. This exposure helps delay the body's internal clock, making it easier to stay awake later and sleep longer in the morning. Avoiding bright light early in the day, especially immediately after waking, can also help. In addition, maintaining a consistent sleep schedule, limiting naps, and creating a relaxing bedtime routine can support more stable and restful sleep. For those who continue to struggle with early awakenings, it's important to speak with a healthcare provider. While an advanced sleep phase is often a natural part of aging, other conditions, such as depression, anxiety, chronic pain, or medication side effects, can also cause similar sleep disruptions. A thorough evaluation can help rule out underlying issues and guide appropriate treatment if needed. Waking up at 3 a.m. can be unsettling, especially if it becomes a nightly pattern. But by recognizing the role that changes in the circadian rhythm play with age, older adults can take comfort in knowing that the shift is normal and manageable. With the right strategies and support, it's entirely possible to regain a sense of control over sleep and wake feeling more refreshed, even as the body's rhythms evolve over time. Number 3. Physical discomfort or health problems. As we grow older, it's common to notice changes in the body that affect our comfort, both during the day and at night. Physical discomfort and chronic health issues often become more noticeable with age, and unfortunately, these factors can significantly disrupt sleep. What might once have been a minor ache or occasional restlessness may now evolve into a nightly challenge, preventing the body and mind from fully relaxing. Many older adults find themselves tossing and turning in bed, not because of stress or poor habits, but simply because of discomfort, pain, or other medical conditions that interfere with rest. Understanding the link between physical well-being and sleep is the first step toward improving both. Many different types of physical discomfort can disturb sleep. Joint pain from arthritis, for example, is especially common in older adults and tends to worsen at night when movement is limited and pressure builds up on sensitive areas. Back pain, muscle stiffness, or past injuries can also make it difficult to find a comfortable sleeping position. Even minor but persistent irritations, such as restless leg syndrome, muscle cramps, or tingling sensations, can keep someone awake for hours. These issues may cause frequent awakenings throughout the night, leading to fragmented sleep that leaves the person feeling unrefreshed in the morning. In addition to musculoskeletal discomfort, A wide range of chronic medical conditions can impact sleep. For instance, heart disease, chronic obstructive pulmonary disease, COPD, and asthma may cause breathing difficulties during the night. Gastroesophageal reflux disease, GERD, can lead to heartburn or acid reflux that worsens when lying down. Diabetes may cause nighttime fluctuations in blood sugar, resulting in symptoms like sweating, headaches, or the need to use the bathroom more often. Even urinary tract issues, such as benign prostatic hyperplasia, BPH, in men or overactive bladder in women, can cause frequent nighttime awakenings due to the need to urinate, known as nocturia. Another important factor to consider is how certain medications affect sleep. Many older adults take multiple prescriptions for various conditions, and some of these drugs may have side effects that interfere with restful sleep. For example, diuretics, often prescribed for high blood pressure or heart failure, increase urination and may cause nighttime awakenings. Some medications can cause vivid dreams, dizziness, or even stimulate the nervous system, making it harder to fall asleep or stay asleep. In these cases, the medication schedule or dosage may need to be adjusted under the guidance of a healthcare provider. Mental health also plays a role in physical discomfort. Anxiety, depression, and emotional stress can amplify the perception of pain or discomfort and make the body feel more tense. This can create a cycle where discomfort leads to poor sleep, and poor sleep, in turn, worsens the body's ability to manage pain or cope with illness. It's a difficult cycle, but not an impossible one to break. Thankfully, there are strategies to address these issues. First, managing chronic health problems with the help of healthcare professionals is essential, not just for overall health, but for better sleep. Pain management plans, physical therapy, relaxation exercises, and better sleep positioning can all reduce nighttime discomfort. Creating a soothing bedtime routine, using supportive pillows or mattresses, and keeping the bedroom cool and quiet can also make a difference. In conclusion, physical discomfort and chronic health conditions are key contributors to sleep disturbances in older adults. While these problems are common, they are not something to simply accept or ignore. With awareness, proper care, and the right adjustments, it's possible to improve comfort and restore the kind of rest that nourishes both body and mind, one peaceful night at a time. Number 4. Lifestyle changes. As people age, the rhythms and routines of daily life naturally begin to change. Retirement, children leaving home, reduced social obligations, and changes in physical energy levels all contribute to a shift in lifestyle. While these transitions can bring freedom and more time for relaxation, they can also unintentionally disrupt healthy sleep patterns. Many older adults find themselves staying up later than usual, napping more during the day, or lacking the structured routines they once had. These changes, though subtle at first, can accumulate over time and lead to difficulty falling asleep, staying asleep, or waking up feeling rested. One of the most common lifestyle changes in older adulthood is retirement. Without the need to wake up early for work or maintain a strict daily schedule, many seniors begin to follow a more flexible and sometimes irregular routine. While this freedom can be enjoyable, it can also confuse the body's internal clock, also known as the circadian rhythm, which thrives on consistency. Going to bed and waking up at different times each day can weaken the body's natural sleep-wake cues, making it harder to fall asleep at night or wake up feeling refreshed in the morning. In addition to irregular sleep schedules, increased daytime napping is another factor that affects nighttime rest. As people age, they may feel more tired during the day, whether from physical fatigue, medications, or simply boredom. While short naps can be refreshing, long or frequent naps, especially in the late afternoon or evening, can reduce the drive to sleep at night. This creates a cycle where individuals stay up later than they intended, get less sleep overall, and then feel the need to nap again the next day. Lifestyle changes can also include reduced physical activity. Retirement and aging can lead to a more sedentary lifestyle, with fewer opportunities for regular movement. Lack of exercise not only affects physical health, but also reduces the body's natural desire for deep, restorative sleep. Without sufficient physical activity during the day, the body may not feel tired enough at bedtime, leading to restlessness or insomnia. Social and emotional shifts also play a role. Loneliness, social isolation, or the loss of a spouse or close friends can have a deep impact on mood and mental well-being. These emotional changes can affect the desire to maintain a structured routine. Without motivation to get up and engage with others or participate in daily tasks, some older adults may spend more time in bed, watching television late into the night, or engaging in behaviors that disrupt natural sleep rhythms. Moreover, dietary habits may change as well. Some individuals may begin eating dinner later, consuming heavier meals in the evening, or drinking more caffeinated or alcoholic beverages, all of which can disturb sleep. Alcohol, in particular, may make people feel drowsy at first, but often leads to poorer quality sleep and more frequent awakenings during the night. Technology habits can also change with retirement or more time at home. More screen time in the evening, whether from televisions, tablets, or smartphones, can expose the eyes to blue light, which suppresses melatonin production and delays the natural onset of sleep. Without realizing it, the increase in screen use may slowly shift sleep patterns over time. The good news is that these lifestyle-related sleep disturbances are not irreversible. Restoring a healthy daily rhythm is entirely possible with conscious effort. Keeping a regular sleep schedule, limiting daytime naps, engaging in daily physical activity, staying socially connected, and reducing screen time before bed can all promote better sleep. Even small adjustments can have a powerful effect over time. In conclusion, while aging brings natural changes in lifestyle, it's important to recognize how these shifts can influence sleep. By maintaining structure, staying active, and practicing healthy sleep habits, older adults can enjoy not only a fuller life but also more peaceful and restorative nights. Number 5. Deep psychological and emotional states. As we grow older, life naturally brings about many emotional and psychological changes. These changes, though often subtle, can run deep and have a profound impact on our overall well-being, including our ability to sleep. Emotional experiences such as grief, loneliness, worry, regret, or even unspoken fears about aging, health, or mortality may settle quietly in the background of daily life. While they may not always be visible to others, these emotions can surface at night, just as we are trying to rest, making sleep feel elusive or restless. One of the most common emotional experiences in older adulthood is grief. As we age, we are more likely to experience the loss of loved ones, spouses, siblings, close friends, or even adult children. These losses leave emotional voids that take time to heal. While daytime distractions might help temporarily, the stillness of night often brings these feelings to the surface. Thoughts begin to race, memories arise, and a sense of longing can make it difficult to relax into sleep. Loneliness is another powerful emotion that can affect sleep, especially in older adults who live alone or are no longer as socially active. The absence of companionship or meaningful connection can lead to feelings of isolation, which in turn can contribute to depression or anxiety. Both of these emotional states are closely linked with sleep problems. Depression may cause either excessive sleeping or insomnia, while anxiety tends to make the mind overactive at night, preventing the deep mental calm needed for restful sleep. In addition to loneliness and grief, many older adults carry unresolved regrets or worries that become more noticeable with time. As life slows down, the mind may revisit past decisions, missed opportunities, or unspoken words. This type of reflection is natural, but if it becomes excessive or overly critical, it can lead to a cycle of negative thinking. These thoughts, especially when they appear just before bedtime, create mental tension and keep the brain in a state of alertness, making it difficult to fall asleep or stay asleep. Another emotional factor is the fear of declining health or the uncertainty of what the future holds. Medical issues, mobility challenges, and the need for increased care can lead to a sense of vulnerability. Even if physical health is stable, simply anticipating possible illness or dependency can create stress. Some may also experience nighttime panic or anxiety attacks related to these fears. These deep psychological states may not always be spoken aloud, but they are felt deeply, and they affect the body's ability to rest. Sleep itself can also become a source of stress or performance anxiety. When sleep problems develop, people may begin to worry each night about whether or not they'll be able to fall asleep. This worry can become a self-fulfilling prophecy. The more a person tries to force sleep, the more elusive it becomes. Over time, this can turn bedtime into a source of dread rather than peace, reinforcing poor sleep patterns. Despite these challenges, it is important to know that emotional and psychological influences on sleep are not permanent or unchangeable. Talking openly about feelings, whether with a trusted friend, family member, or counselor, can help release emotional weight. Mindfulness practices, gentle breathing exercises, or calming evening routines such as reading, listening to soft music, or prayer can help create a sense of inner peace before bed. For those experiencing chronic anxiety or depression, seeking professional support can make a meaningful difference, not only in emotional health, but also in sleep quality. In the end, recognizing the deep emotional undercurrents of aging is a vital step toward healing and rest. When we honor these feelings with compassion and take steps to gently care for our emotional well-being, we can rediscover the quiet comfort of peaceful, restorative sleep. Number 6, increase sensitivity to environmental factors. As people age, their sensitivity to environmental changes tends to increase, often making it more difficult to maintain consistent, quality sleep. Factors that may have gone unnoticed earlier in life, such as room temperature, light exposure, or even ambient noise, can now become significant barriers to restful sleep. This heightened sensitivity is not just a matter of preference. It often reflects real changes in the brain and body's response to external stimuli. Light, for example, plays a crucial role in regulating the body's circadian rhythm, the internal clock that signals when it's time to sleep and wake. In younger adults, even small amounts of light may not have much of an impact on sleep. But for older adults, exposure to light during the evening, such as from a hallway lamp, street lights outside the window, or screens from televisions or phones, can disrupt the production of melatonin, the hormone that induces sleepiness. As melatonin production naturally declines with age, any added disruption from light exposure can significantly delay or fragment sleep. Temperature is another critical factor. Older adults are more likely to experience changes in how their bodies regulate heat. Some may feel too cold in environments others find comfortable, while others may become overheated more easily. A room that is just a few degrees too warm or too chilly can interfere with the ability to fall asleep or stay asleep throughout the night. This is because the body needs to slightly lower its core temperature to initiate sleep, and any disturbance in that process can result in restlessness. Noise sensitivity also tends to increase with age. Even subtle sounds, such as a ticking clock, distant traffic, or a neighbor's footsteps, may become sources of disruption. While younger individuals might easily tune out these background sounds, older adults may awaken more frequently due to lighter sleep stages or decreased auditory filtering. Frequent awakenings due to noise can reduce the overall quality of sleep and lead to daytime fatigue or irritability. In addition, unfamiliar sleeping environments, such as those encountered during travel or hospital stays, may pose even greater challenges for older individuals. These settings often come with different lighting, temperatures, beds, or levels of activity around them, all of which can interfere with the sense of comfort and safety that is essential for sleep. To address these sensitivities, it's helpful to create a stable, sleep-friendly environment. This might include using blackout curtains, white noise machines, or adjusting bedding materials to maintain the right temperature. Making sure the bedroom is a quiet, dark, and soothing space can go a long way toward improving sleep. Small changes, such as dimming lights in the evening, minimizing screen time before bed, or using a fan for both airflow and white noise, can help ease the body into sleep more naturally. Ultimately, understanding and adapting to increased sensitivity to environmental factors is a compassionate and practical step toward protecting one's sleep health as we age. It's not a sign of weakness or fragility, but rather a gentle reminder of the body's evolving needs that, when honored, can lead to deeper, more restful sleep. Number 7, medication side effects and polypharmacy. Another major contributor to sleep disturbances in older adults is the use of multiple medications, often referred to as polypharmacy. As people age, they are more likely to develop chronic health conditions such as high blood pressure, diabetes, arthritis, or heart disease. To manage these conditions, many older adults take several prescription medications daily. While these medications may be necessary and helpful, they can sometimes come with side effects that interfere with sleep. Certain medications have stimulating effects or may disrupt the body's natural sleep-wake cycle. For example, some blood pressure medications and asthma treatments contain ingredients that increase alertness or cause nighttime awakenings. Others, like diuretics, are designed to flush excess fluid from the body, which may lead to frequent nighttime urination, another common cause of sleep fragmentation in the elderly. Pain medications, particularly those that include opioids, can also affect sleep quality. While they may reduce physical discomfort, they can also alter the structure of sleep, suppressing deeper stages of rest and leading to increased drowsiness during the day. Similarly, antidepressants or anti-anxiety medications may cause either sedation or restlessness, depending on the individual's response and the timing of the dose. In addition to individual side effects, the combination of multiple drugs can result in interactions that further complicate sleep. When medications affect each other's metabolism or compete for the same pathways in the body, they may amplify unwanted effects, such as confusion, dizziness, or vivid dreams, that can disturb the sleep cycle. Some individuals may also experience rebound insomnia if a medication is reduced or discontinued too quickly. It's also important to note that many older adults may use over-the-counter medications or herbal supplements to help with sleep, unaware that these two can interact with their existing prescriptions. Ingredients such as diphenhydramine, found in many sleep aids, can lead to grogginess, confusion, or increased risk of falls, especially when combined with other sedatives. To manage these issues, it is important for older adults to have regular medication reviews with their healthcare provider or pharmacist. These reviews can help identify medications that may be causing sleep disturbances or interacting negatively with one another. Sometimes, simple adjustments, like changing the time a medication is taken or switching to a different formulation, can significantly improve sleep quality. Understanding the impact of medications on sleep is not about avoiding necessary treatments, but about being informed and proactive. By working closely with healthcare professionals, older adults can find a balance that supports both their physical health and their ability to get restorative sleep. This balance is essential because sleep is not just a comfort, it's a vital part of the healing process and a foundation for emotional and cognitive well-being. As we age, sleep is no longer simply a part of our daily routine, but an important indicator of our physical and mental health. Through natural changes in the body, such as reduced melatonin production, changes in sleep cycles, or increased sensitivity to the environment, older people often face problems with light sleep, difficulty falling asleep, or waking up many times during the night. In addition, health problems, changes in lifestyle habits, loneliness, and the use of various medications also contribute to poor sleep quality. However, the most important message is that sleep quality is not only a reflection of health, but can also be improved with attention and adjustment from each person. Recognizing the causes of sleep disorders is the first step to better self-care. A quiet, warm sleeping space, a regular lifestyle, understanding one's own emotions, and regularly discuss your medications with your doctor. These are all small actions that can make a big difference. Sleep is a precious moment of peace between worries, a time when the body is restored and the mind is at rest. In old age, learning to sleep again fully is a way for us to love ourselves more gently, more attentively, and more peacefully. Instead of considering changes in sleep as inevitable, the elderly can completely adapt and improve the quality of life every day. Because a good night's sleep not only brings health, but also a spiritual gift for the peaceful years ahead. Thank you for joining us today. We'd love to hear from you. Leave a comment below and share one thing you learned today and how you plan to use it in your life. Your thoughts are important to us, so don't hesitate to share them. Reading your comments gives us great motivation and encouragement. If you enjoyed this video and found it helpful, please like, subscribe, and share. Your support helps us continue creating good content to inform and inspire you. Thanks for watching, and we look forward to seeing you in the next video.